watching Let's Chat.
Welcome back to Let's Chat. This morning we are diving into an appropriate topic as we follow the sweet weekend of Halloween, and it may be something you're not thinking about. Joining us, of course, Coach Maurice. Good morning, Coach.
Good morning. Thank you.
All right, so we are actually talking about our mouths this morning. We are talking about flossing, taking care of our gums, because we're talking about gum disease. Why is this so important, and how does gum disease play into our overall health?
I mean, who would have thought flossing twice a day and brushing at least once a day, twice is preferable, can really cause other health issues? Years ago, Dr. Amen from the Amen Clinic said if you're not flossing twice a day and Alzheimer's runs in your family, you're likely to increase those chances. Now the studies not only support the memory loss due to flossing, which I'll explain, but now they're seeing other side effect from not flossing and brushing your teeth on a regular basis. Experiment by the researchers in the Faculty of Dentistry at the University of Toronto in Canada have revealed that gum disease prime blood cells called neutrophil, which then overreact to infection elsewhere in the body, and that can lead to increase of arthritis, heart disease, diabetes, cancer, respiratory disease, dementia. This is really, really big. It's not just a cosmetic issue and a comfort and discomfort to be able to chew. This has to do with a lot of other symptoms that could be already developing in your body if you're not consistent with flossing and brushing your teeth. This is interesting.
It is. I would have never thought that these two actions were related to health issues that you just mentioned. Earlier you said how often we should be flossing, of course, how often we should be brushing our teeth, but let's remind everyone, how often is enough to be flossing our teeth to prevent these other health issues?
Yeah, I mean, they recommend twice a day to floss, and they recommend twice a day to brush your teeth. Maybe morning and evening would be best before you go to bed. The biggest concern is do not go to bed without brushing your teeth and flossing. That is really the most important time because you don't want all that infection to be developing during those 6 to 8 hours of sleep.
Perfect. All right, I want to switch gears just a little bit. Of course, we talk about brushing our teeth in the morning, but here's another activity that we should be doing, and that is early morning exercise. And this is now linked to our risk of cancer, right?
It is. I've been teaching for years that if you can exercise first thing in the morning, you will burn twice the fat than any other time of the day. Now science is taking it a step further. They're saying that research has shown that doing recreational exercise, it doesn't have to be running, it could be recreational like hiking and biking, can reduce a person's risk of developing many different cancers. In the U.S., scientists estimated that by the end of this year, almost 2 million people will have cancer and almost 600,000 people will die from cancer this year alone. And the problem is we're not getting enough activities. Almost 50% of the population is not getting their recommended daily activities. So now they're saying that the evidence is showing that early morning exercise, because one of the factors, especially for the ladies with breast cancer, and also with other type of cancers, the estrogen level is high in the morning. When you exercise, you lower your estrogen level. That can prevent cancer from happening. That time is between 8 and 10 a.m. seems to be the best time to exercise if your schedule allows you. This is really interesting. This is big, especially for the ladies when it comes to breast cancer and also weight loss because you burn twice the fat.
Wow, I never would have imagined that early morning exercise would be linked to reducing our risk of cancer. How incredible. Of course, Coach Maurice, we always enjoy joining us this morning because you have these fun facts and figures that we would have never known otherwise. Of course, if we want more information, we can always visit you on your website, correct?
Absolutely. Yes, ma'am. Absolutely.
Right.
bridgetohealthandwellness.com.
All right, of course, we will talk to you again next week. Hope you have a wonderful week. Happy November. Hard to believe we're already there. And we will talk to you again soon. For more information or to set up a consultation, visit bridgetohealthandwellness.com.